Hello everyone. Hello everyone, and welcome to this audio podcast. This audio podcast is part of the Photon Saga. This audio podcast is part of the Ghromulin series, and this audio podcast as part of a Storm Robotics production. Today, looking at methodology, the sort of methodology aspects as part of works from 2008, in looking at the role of endogenous opioids, EOPs, in ischaemic preconditioning in humans. The method, as part of the method, in looking at the methodology, looking at the methodology aspects. So the role of the role of opioid receptor blockade. So a pharmacotherapy, a pharmacological agent known as naloxone. The role of opioid receptor blockade, naloxone, was used in ischaemic preconditioning, in around ischaemic preconditioning, in on healthy human volunteers, which helped to determine which helped to determine sort of the to determine the sort of the effects of in and around the role of naloxone, in around naloxone, sort of as part of sort of the sort of crux of this works. In As part of this works, there was a human there was a human forearm ischaemic reperfusion injury model. So whereby, for example, ischaemic reperfusion injury, for example, was sort of implemented, for example, by the use of a arterial blood pressure cuff, a sort of a cuff in around a part of the forearm to replicate a basis of ischaemia, a part of the forearm where there was a lack of blood flow. At the same time, flow mediated dilatation, or FMD, of the brachial artery was measured by the use of ultrasound to determine endothelial ischaemic reperfusion injury. At the same time, at the same time, at the same time, at the same time, as part of this works, using in around sort of the laboratory aspects, the laboratory medicine aspects of this works, where we're using enzyme linked immunosorbent assay or ELISA. A beta endorphin in around beta endorphin was quantified to establish or identify whether it had a local effect to induce protection during ischaemic reperfusion injury. And then venous blood samples were collected from healthy volunteers during the IPC stimulus during the IPC stimulus. Uh, during the sorry For example, again, during the IPC stimulus. A subsequent audio podcast as part of this series, as part of this Ghromulin series, we'll look at the sort of the protocols, protocols, and where sort of where there will be a sort of an iteration in around the sort of overview of the procedure in around around this works. To also iterate listeners and viewers, to also iterate listeners and viewers, this works. There was full ethics approval in around 2008 when this works took place. Colleagues and collaborators at the time had 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 for sort of for ethics approval before sort of before where before this works could actually sort of take place. So that draws this audio podcast to a close. This audio podcast as part of the Ghromulin series, this audio podcast as part of the Photon Saga, and this audio podcast as part of a Storm Lobostics production.